Okay, so now we're to chapter 9. This is the last chapter in this unit, and it's kind of lumped together with reproductive systems because this is a part of it. It's obstetrics and neonatology. So obstetrics is really about the woman and her entire pregnancy and what's happening there, as well as the developing embryo fetus up to birth. And then neonatology, as you'll learn, is the study of new babies after they're born. So that's kind of what we're finishing out this unit with. So first we need to figure out what's involved, and you already learned the female reproductive system, so that helps a little bit. And as I mentioned, in this case, obstetrics is really a branch of medicine that focuses on childbirth and then focusing on the mom. So yes, there's the fetus inside the mom, so obstetrics covers all of that. But then focusing on the mother before she has the baby, delivering the baby, and then after. Neonatology's specific focus is the newborn. So once the child has been born, looking at diseases and disorders there. All right, so this is a lot of vocab, but I feel like most of you should know this already. So a gamete is just a sex cell. So whether that is going to be an egg or a sperm, those are both considered gametes. Ovulation, we kind of learned a little bit last chapter. That's when an egg becomes mature and then gets released once a month. If that egg then gets fertilized by a sperm, that's called conception or fertilization, and that technically starts the beginning of pregnancy. From there, that developing set of cells is called different things. So initially, it's called a zygote. Once that fertilization has occurred and you now have egg and sperm together, that's a zygote. That zygote turns into an embryo. And as it says here, it's from implantation of the zygote to the end of the 8th week. So the zygote is the first couple rounds of cells, and then it implants itself on the uterine wall. At that point, we call it an embryo until 8th week of pregnancy is done, and then it transitions to being called a fetus until it's born. Then it's a baby, technically. Gestation is the fancy word for length of pregnancy. So in this case, for humans, it's 40 weeks. Is kind of that hallmark time period. As it translates, 40 weeks is roughly 10-ish months. But then you think, oh, why are we only pregnant for 9 months? It's kind of like when you figure out you're pregnant, you're already kind of a month in at that point. Implantation is when that little zygote of cells embeds itself on the uterine wall so it can stay there and grow and develop. In terms of what happens during pregnancy, we have a placenta. It's also called afterbirth because once you deliver a baby, then you technically deliver the placenta afterward because it's not something that the mother will need after the baby is born. But it's basically the blood system, and you can see that in the picture here we have the placenta in red that grows on the wall of the uterus and feeds into the umbilical cord that then nourishes that baby. The amniotic sac is that set of, or that fluid-filled bag that surrounds the baby, so it kind of floats around, acts as a buffer, so the little developing fetus isn't bouncing around. And then outside of that, there are many layers to the amniotic sac. So we have the chorion, which is the outermost layer, the amnion, which is the innermost layer, and then the amniotic fluid, which is that liquidy stuff the baby is floating around in. I'm going to call it a baby just for simplicity's sake, but when it's in the mother, it's technically an embryo or fetus, depending on how far along it is. So in terms of what happens, you can see from the woman's left ovary, which is the picture's right side, you can see that the tiny egg cell matures and then starts to make its way down the uterine tube. Fertilization usually occurs in the uterine tube. The little swimmers make their way up and travel along the uterine tube. At that point, it's now a zygote, and then the zygote continues to travel along the uterine tube into the uterus and then eventually implants itself on the uterine wall. We will get into a point where, what if that doesn't happen? What if it implants itself in the uterine tube? You can imagine that this little tiny tube is not conducive to, a 10-pound baby being born. So we'll get into that a little later. Just to give you a little perspective, this is what a little boy looks like at 13 weeks of pregnancy. So this would be technically a fetus because it's past the 8-week mark. But then if you think about going all the way to 40 weeks, it looks a lot like a baby considering it's got to make it all the way to 40. Generally around 12 weeks is when you can tell a lot about the baby. You can start to get an idea of then the sex of that baby. Okay, so here is a similar picture that you might have. In your diagrams, but we haven't learned the words yet, so bear with me. We're going to put combining forms to it in a minute. Somehow got out of order. Okay, so here we go, word parts. First up we have amnio and amniano. Both of those are referencing either the amnion as the sac itself or amniotic fluid that the baby is floating around in. It can kind of be used interchangeably. Choreo is for chorion, the outermost layer of the amniotic sac or that membranous lining. Embryo is for embryo, so that one's pretty easy, just add the slash. Feto and feti both mean fetus, or generally speaking, the unborn child. Gravido is the first of many terms that mean similar things. Gravido means pregnancy. So if we're talking about, a woman's first pregnancy or other types of things associated with that, we're going to use gravido. Lacto, I always think of like lactose intolerant, so that you can think of lacto meaning milk. Nato is birth. So when you talk about neonatal, it means new birth. Umphalo means your umbilicus or your belly button, essentially your navel. So anytime there's an issue or something wrong with the umbilical area, you're going to use umphalo. Paro and parto both mean childbirth. Usually it's referring specifically to labor itself and the act of childbirth. And then to throw a wrench in things, we also have porporo, which also means pregnancy. Mouthful of words. Paro, parto, and porporo all mean childbirth. So those usually have to do with the act of labor itself and giving birth, whereas gravido is more about generally the pregnancy. So take a moment, if you can, add these to your diagrams. The picture that I had up is on page 318. You can label it there as well. Okay, so now we're to the combining forms that we use with this, and some of them we've seen before, so it shouldn't be totally new to you. So cephalo means the head or the head region. Esophago, from the digestive system, means esophagus. And what you'll find is that one in combination with pyloro, which means the pyloric sphincter, is kind of a congenital thing that some babies are born with and issues in that area. And if we remember, the pyloric sphincter is responsible for kind of acting as a closing stop between the esophagus and the stomach to prevent the backflow of stomach acid into the esophagus. So that's kind of one of those birth problems that often occurs. Primi means first. So we also had a couple other things that mean first or before. Primi means first, so in the sense of like your first pregnancy, your first birth. Pseudo means false. And then terito is a generic term. Literally, it means monster, but historically speaking, it has arisen to mean malformation. So if your child is born with some kind of malformation, like a cleft palate or something else that we'll learn, then terito might be used. There are several prefixes and suffixes. Ante or pre means before, not to be confused with primi from the last side that means first. Micro, I'm hoping you all know, means small. So like microcephalus would mean a small head. For instance, that's one of the congenital conditions associated with Zika virus. Multi means many. So multigravida means that you have been pregnant many times. Nulli means none. So if nulli gravida means that you have never been pregnant. Post means after. So for example, postpartum would be referring to after labor. So like or referring to the woman after she has given birth. There are a couple of suffixes too. Amnios is going to be reference to the amnion or amniotic fluid. So we had amnio as a word root, but now we also have it as a suffix depending on how you need it. Sciasis, we can add to the list of things that mean pregnancy. So we had gravido, which meant pregnancy, as a word root, and now we have sciasis as a suffix, meaning the same thing. You'll notice 4 of these suffixes on the list don't actually mean anything. Their goal is to take whatever it is that you're putting together and turn it into a noun, oftentimes giving it a condition or a state that you're in. So is, and us all just turn whatever it is you're combining into a noun. So for example, postpartum means after birth. Rhexis is another one of those RRH. We've had rhea, regia, and now we have rhexis. In this case, it means rupture. So breaking, if you can think about the amniotic sac at some point, the water breaks. You could use rupture in that sense. Tosia or tokia, either one is correct, appropriately said. That means birth or labor. So if you're having a difficult labor, which that would be dystocia, which I can imagine that all of them are difficult or painful, having had 2 children. But tosia is the suffix version of paro, parto, and popero, which also all mean childbirth. Okay, so this kind of puts it in context of word parts that have similar meanings. So nato means birth. Usually it's referred to as like the newborn itself when you talk about neonatal. Paro, parto, and popero all mean childbirth. And then tokia or tosia means labor as well. Here are all those R ones. I forgot about Rafi. It tells you what chapter that we've been introduced to these. So we have rhea, regia, which we actually learned last chapter for the female reproductive system, Rafi, and rhexis. So which one of these means pregnancy? So one of these refers to the pregnancy itself, and one of them refers to the labor or act of childbirth. So in this case, A is the best answer. Okay, so we're finally to the part about putting diseases together. There's a couple of picture representations of suffixes and things like that in your book that you might want to try on 321. But here we go with the actual diseases. And you'll notice there's not a lot, so that's good. But I feel like of all the chapters in this unit, this chapter is deceivingly difficult because of all the words that mean similar things. And you're not as familiar with this as you are perhaps your urinary or reproductive system. There's lots of things that can get inflamed. So we have amnionitis or chorioamnionitis, depending on what layers of the amniotic sac are inflamed. We can also have choriocarcinoma, which would be then a cancerous tumor of that outer lining, the chorion. Dystocia, dystocia, as I had mentioned, means difficult or painful labor. And yes, all labors are painful, but this is kind of more than normal. Usually it's obstructed or the baby's in the wrong position, that kind of thing. Hysterorhexis. If we remember back to the last chapter, hystero means uterus, so you can rupture your uterus if the baby is too large or something happens. You can also have things where your baby's floating around in an amniotic sac. There's a predetermined correct amount of water to have the baby floating around in. So if you have too little or too much, we have conditions for that. Oligohydramnios would mean that you have too few water or too little water, and I just kind of put a number there for you to give you perspective. And polyhydramnios means that you have too much. So the sweet spot is anywhere between like 500 and 2 liters. 500 milliliters is a half a liter for those who don't know. At this point, go ahead and I would say just try these out on page 323 before we move on to the list of not from word parts. All right, so I feel like everyone has heard of abortion. You might have also heard it as miscarriage is actually a form of abortion. It's called a spontaneous abortion. There's different categories, but really it just means that the embryo or fetus has been removed prior to 20 weeks of gestation. Abrupto placentae sounds like it's from word parts or Latin, but it's more of just having that sound. What that means is your placenta has separated from the uterine wall. So normally it likes to sit itself on the uterine wall where it hangs out so it can nourish the baby, but when it detaches itself, then it can cause a lot of problems. Next we have eclampsia, which goes along with preeclampsia. Starting with preeclampsia, it's an abnormal condition that pregnant women have. It's either during pregnancy or very shortly after, but it leads to really high blood pressure, protein in your urine. At that point, there's no convulsions. When you transition into eclampsia, then it's actually having convulsions associated with it. The cause is really unknown, but if you treat it right away, it's okay. But if it goes all the way to eclampsia, it could potentially be life-threatening. Ectopic pregnancy is what I had mentioned previously. If your zygote implants itself in the uterine tube instead of the uterus, or really I guess it could go past the uterus and implant lower. If it implants anywhere generally that's not the uterus, then it's called an ectopic pregnancy. And usually it has to be terminated because it would probably or most likely kill the mother before the baby got to full size. Placentae previa is an abnormally low implantation of the placenta. So you want the placenta to stick to the uterine wall, but if it does so low that it's basically blocking the exit path for the baby, that's a problem. So oftentimes then when the woman goes into labor and her cervix dilates, it can cause tons of bleeding because it'll most likely rupture that placenta. Okay, so as I had mentioned, there's different types of abortions. I'm not going to require you to know what all the different types are. I just wanted to, inform you. So again, the spontaneous version is called a miscarriage. It just happens naturally with no really known cause. And then there's reasons to induce this. So the one that we traditionally think about is elective abortion, where a woman decides that she doesn't want to have a baby. There's also a category called therapeutic. And so that would be when the woman is pregnant, but the pregnancy itself is causing such a health risk to the mom that the mother could die as a result. So if then they decide to terminate the pregnancy, it would be considered a therapeutic abortion, not elective, because they're saving the mother's life by doing so. So here's one example of the abrupto placentae where it has detached from the wall. So on the left is happy and great and healthy, and then you can see on the middle and right what that looks like. The amniotic sac in general starts to cause a problem. There's a lot of bleeding and so on. Here's the placenta previa, where it kind of goes down and obstructs the exit path, and you can see how it can cause bleeding for the mother. Here's an example of that ectopic pregnancy. You can see the uterine tube was not designed for development of a fetus or an embryo. And most likely that's very painful for the woman. Okay, so now we're to diseases and disorders associated with neonatology. So this chapter kind of splits up obstetrics, and then we have neonatology diseases, so associated with the newborn. Microcephalus is, as I had mentioned before, the baby has a small head. Omphalitis would be inflammation of the umbilical area, because if you imagine the umbilical cord was attached to the placenta inside the mom, and then they cut that, so it can become inflamed. And omphaloceal, if we remember, seal would be like a herniation or a protrusion. In this case, oftentimes what happens is the abdominal wall hasn't fully sealed over in the umbilicus, so the intestines actually kind of protrude out through the abdominal wall at birth. There's a picture in your book too. I think I have it in the PowerPoint. Pyloric stenosis is another one where there is a narrowing of the pyloric sphincter, which can cause a problem when you're trying to eat. And then we have tracheoesophageal fistula. If you remember, a fistula is when you have an opening between two places that aren't supposed to have an opening. In this case, between your trachea, your windpipe, and your esophagus, your food pipe. So you can imagine how you probably would not want to have those joined together. Exercise 21 just gets you practicing these before I move on to the ones not from word parts. All right, so which one of these is in the photograph? The only difference is the O. So omphaloceal, you can see that in this baby boy, the umbilical region didn't kind of block entirely. There's a hole in the abdominal wall, so the intestines are kind of protruding out. It looks really, really bad, but generally speaking, what they would do is kind of basically push it all in, stitch it up, and then baby would be fine. Okay, so not from word parts. The first one we have is a cleft lip, or it could be a cleft palate. So in this case, there's kind of a malformation at birth, or a split between the lip and the upper roof of the mouth, or just generally the roof of the mouth. It's a fairly common condition that can be fixed with a surgery. Down syndrome is a genetic condition. It's caused by having an extra 21st chromosome. And there are certain hallmark features associated with them, as well as intellectual and developmental defects associated as well. Next we have erythroblastosis fetalis. So this is where the newborn has red blood cell problems. This is, if you've ever learned about Rh compatibility, blood cells have, You can be type A, type B. You can also be Rh positive or Rh negative. And so sometimes what happens is that the mother might be negative and the infant's blood might be positive, and then there's an incompatibility there. So then the newborn has some blood problems as a result. And so normally the mom gets a giant shot when they figure this out during pregnancy to avoid that situation. Esophageal atresia. Atresia means that they're basically lacking a part. So there's a picture in your book, but a piece of the esophagus is missing. As you can imagine, the baby cannot eat without a fully functional esophagus. So there are things to do to correct that as well. Fetal alcohol syndrome. You might have learned about this in health class. Basically, the mom drinks too much alcohol during pregnancy, and then some birth defects result, including nervous system problems, some skull and face malformation. Gastroschisis, saying that all together, we have gastroschisis, is when there is a fissure of the abdominal wall, not at the umbilicus. So we had shown you the omphalocele where there was a protrusion through the umbilical cord. If it actually happens in another area, so for example through the stomach, then that would be gastroschisis. RDS, or respiratory distress syndrome, is something that happens with newborns, especially premature infants, because the lungs are one of the last things to fully develop. And basically it just means that the lungs aren't quite ready to handle breathing air, so then they have a hard time breathing. Next we have spina bifida. So this is where the vertebral column and the didn't quite close correctly, so the actual meninges, if we think about those layers surrounding your brain and spinal cord, actually stick out through what we call a meningeocele, a protrusion of those meninges. And there's some pics in your book on page 329 above exercise 24. So go ahead and try the matching on exercise 24 so that you can kind of get the specific definitions I'll be looking for. Here's an example of the congenital split. This would be a cleft lip and cleft palate. You can imagine how eating and breathing would be difficult. This would be an example. So chromosomal abnormality, this is Down syndrome. Here's the graphical example of esophageal atresia. So there is a gap in the esophagus. So they can stretch this or put in some kind of artificial piece and stitch it together to hopefully get a functional esophagus. Here's gastroschisis. You can see the umbilicus is over here. So there's not a protrusion through there. It's through a different area, and you can see the intestines and other things. So that is not a happy camper right there. Here we have spina bifida. You can see that in this case it's not super dramatic, but it could be. You can see the meninges kind of sticking through this deformity right here. A meningeomyocele would be kind of all of that sticking out through that protrusion, and that's kind of what you see here. There are varying degrees of this. Okay, so now we're to the surgical terms. Going to obstetric, and there's a few. Sometimes if the baby does not want to be born, then the doctor will purposefully break the mother's water, so to speak, or do an amniotomy. Or we could also do an episiotomy, which, if we remember, episio is vulva. So if you're asking yourself, why would you ever make an incision into that area? Sometimes you have a giant baby getting through a very tiny opening. So sometimes it's medically better to, create incisions to make the opening larger rather than cross your fingers and have your large baby tear, because that way it'll heal a little nicer. For diagnostic imaging, obviously with pregnant women, there's a lot of ultrasounds. So the fancy medical way to say that would be pelvic sonography, just to assess and evaluate the fetus. Other things to do is amniocentesis. So this would be where they take a giant needle and suck out a little bit of amniotic fluid, and then they can run a whole bunch of tests on the baby to figure out if it has any genetic conditions or abnormalities. That's usually avoided a lot now based on newer developed blood tests, but it is still performed. Amnioscope and amnioscopy are other tools that are used during that process. So here's an example of an ultrasound. I'm not exactly sure. This is probably like a 12-week-old child. You can see the profile, the tummy, the nose, brain, and other things in here. Here's an example of what amniocentesis might look like. Again, as I mentioned, it's a giant needle. This is performed mostly on older women that become pregnant, so over 35, because the incidence of genetic abnormality is a little bit higher in older women because their eggs are getting old. But that's kind of what that looks like. They also use an ultrasound monitor to make sure that they're not getting too close to the baby. So now we're to complementary terms, and there are a ton. This is only part of the list, but if you're thinking about the fact that they are mostly from word parts that you've already known, we just kind of put them together in new and different ways. If we think back to all the different things that mean pertaining to, we have AL, OUS, IC, and so on. So a lot of these mean pertaining to certain areas. Let's see. And then we also learned a bunch of suffixes that turn things into nouns, like UM. So antepartum, for example, would mean before childbirth. So the mom before she actually has given birth. Gravida would just be the general term for a woman who's pregnant. Again, the A is just turning it into a noun. Gravidopuerial would be pertaining to childbirth. And that really includes from giving birth all the way until your reproductive organs return to normal. So if you think about a woman giving birth, everything is not back to normal immediately after that baby comes out. It takes about 6 weeks for everything to kind of shrink back down to size and kind of get back on track to what it was before. Interpartum would be during labor and childbirth. Anything with lacto is going to have to be associated with milk. And then we also have things like multigravida and multipara. We can also, as we'll see later on, have similar things with primi. But just to be clear, gravida would be pregnancies and para would be births. Now it's unfortunate to think about, but there are instances where you could be pregnant more times than you've actually successfully given birth. Thinking about miscarriages and abortions and things like that. Here's the second half of the list. One of the words is neonate, abbreviated NB for newborn too. You can use newborn or neonate to reference children who are just born all the way up to 4 weeks. After 4 weeks, they're just a baby. They're not a newborn anymore. If we think about neonatologist and neonatology, the field and person who studies newborns. If you've had no pregnancies or no actual child birthings, then you would be nulligravida or nullipara. Para, just in general, would mean birth. Let's see. We have prenatal and postnatal, which are terms that gets a little bit tricky. So prenatal is specifically before birth, And anytime you see natal, it's always referring to the baby. So prenatal and postnatal are in reference to the baby before and after newborn. But then we have prepartum and postpartum, which are kind of pre and post birth for the mom. That's why this chapter gets so tricky, because there's a lot of words that mean the same thing or similar things. But then you also have to think about, who are you referencing? Are you talking about the baby, or are you talking about the mom? An interesting one is pseudocyesis, which would be a false pregnancy. So this is also called a hysterical pregnancy. Oftentimes it's like a psychological condition where the mom thinks she's pregnant, so she has a lot of actual physical changes as a result. And if we remember, teratogen had to do with a malformation. So a teratogen is anything that can produce these malformations, similar to carcinogens, but this case it would be any specific drugs or alcohol or viruses or environmental factors. Teratogenic would be producing malformations. So for example, drinking alcohol during pregnancy, the alcohol is a teratogen. Drinking alcohol while you're pregnant is teratogenic. And then if you're someone who wants to study that field or study specific malformations, then it's called teratology. Go ahead and work on exercise 32. There's a ton of words that I didn't even talk about, but they're from word parts, so I think you can figure it out. But practicing them is going to be key. So that starts on page 336. This slide is just to kind of put it all together in the sense that there's, again, a million terms that mean the same thing. So whether you're talking about the newborn, you have pre and postnatal if you're talking about the mom. You have antepartum and postpartum. And then we also have terms for pregnancy and birth and what that looks like and what you would use. And again, the A at the end is just to turn it into a noun. So now we're to all the terms that are not built from word parts. The first of which is called an APGAR score. And the APGAR score, there's a picture in your book on page 339 that kind of goes through that. But when a baby's first born, it's kind of like their initial assessment. They do it at 1 minute and again at 5 minutes to figure out if there's any problems. So they look at things like color, they look at breathing, muscle tone, heart rate, and they give it a score, and then based on that they can tell if a baby is going to need more intervention or is going to be fine. Depending on how the baby is coming out of the birth canal, you have a breech presentation, which means feet first, or really anything that's not the head first. Cephalic presentation would mean that your head is first, which is the normal way of delivering a child. Cesarean section is called CS or C-section. That's where they actually cut through the mother's abdomen and uterus to pull the baby out for various reasons. Colostrum is a thin milky fluid that females make before they start producing milk in their breasts. So before lactation starts, colostrum is like a very nutrient-rich milky substance that comes out first that's like really, really, really good for the baby. Congenital anomaly, I'm pretty sure you can figure that out, would be anything that's present during birth. In vitro fertilization, or IVF, so this is what you would think of, I guess, like a test tube baby. So they put an egg and a sperm together in a dish, and then they can screen those and pick out the ones they want, and then they implant those zygotes into the female's uterus, hoping that one or more of them will stick to the lining and the woman will become pregnant. Lactation is just producing milk. Lochia is vaginal discharge after childbirth. So yes, a woman gives birth to a baby, but there is a whole bunch of other stuff that comes out after that. So that's when we have terms like lochia. Meconium is the baby's first poop, essentially. It's this nasty green, black, tarry substance. And if you think about, the baby has actually been acquiring poop during your pregnancy as a woman. So it's been in there for a while, but that's what that looks like. A midwife is someone who practices midwifery, and midwifery is really assisting with childbirth. So it's kind of a more natural, holistic approach. The midwife may be a registered nurse or not, but it's kind of like physical and emotional support if you don't want to give birth necessarily in a hospital. Obstetrician studies obstetrics. So that deals specifically with pregnancy, childbirth, and then the woman after childbirth. So you would go to an obstetrician 6 weeks after childbirth to make sure everything is back on track. A lot of times doctors, you can be only an OB if you want, but a lot of people are OB-GYNs, so they're OBs and gynecologists at the same time, so they can kind of see women all the time. Parturition would be the act of giving birth. A premature infant is anything before 37 weeks, so that's technically 3 weeks early. Any more than that is called preemie. Puerperium would be, again, the 6 weeks post birth that it takes for your body to get back to normal-ish. Quickening is when you can feel the baby start to move around so when you feel the baby kick. Usually that takes between 16 and 20 weeks for the baby to get big enough for the mom to actually feel it squirming around. And then stillborn is when the baby is delivered but unalive. And this would be considered after 20 weeks of pregnancy. So before 20 weeks, it's considered a miscarriage. After 20 weeks, it's considered stillborn, because 20 weeks is kind of the tipping point of when a baby might survive. Okay, so antepartum and postpartum are in reference to the mother. Prenatal and postnatal would be in reference to the baby, and then not birth. Okay, so if you didn't try the matching exercises 35 and 36, please do so with those not from word parts terms on page 341. But the end of the chapter, we have some abbreviations. Most of them are included in terms of what you saw in the chapter, but we also have other terms that you didn't maybe see, like DOB is for date of birth. EDD would be the expected delivery date. So when you ask someone when they're due, that's the EDD. Otherwise, I think most of them. LMP is one you might not have seen. It means last menstrual period. That's when they actually start the pregnancy from the date of your last period, which is why you're technically pregnant for like 10 months instead of the 9 that we normally think about. And then we also have things like VBAC, which means vaginal birth after cesarean. So if a woman has more than one baby, VB would be vaginal birth. CS would be cesarean section. And just because you have a C-section maybe the first time, it doesn't mean you have to have one every single time. So if you have a vaginal birth after a cesarean, they just have to be a little bit careful because your abdominal walls might not be quite as strong, but it's something that is worthy of abbreviation. So you've successfully made it to the end. Please go to the end of the chapter. This passage is on page 347, just going through, putting everything in context, trying out the little content quiz at the end to wrap it all up, and so on. You've successfully made it to the end of Unit 4.